if you don't die, it could be horrendous. Just the side effects, are horrendous.
Yeah.
I mean, just something as simple as, like this intractable nausea, vomiting, and diarrhea that people get, with chemotherapy, where they can't, they come in, they're so dry, they're so miserable appearing, and a lot of times, renal failure, just from that, like a tertiary effect, from being so dehydrated, from not being able to take in anything in my mouth,
Hello everyone, I'm DC. Welcome to the channel. Today I am talking to Dr. Casey Peavler. Now, Casey, he's a young doctor. He started a YouTube channel recently. He is a medical doctor. He's board certified in internal medicine. He specialized training in integrative, functional, and mitochondrial medicines. He practices hospitalist medicine in South Florida in the US. Okay. He's also the owner and medical director of Integra Functional Internal Medicine. So I asked him, after watching some of his videos on YouTube, how he started the journey from conventional care to mitochondrial health. Again, thanks for joining me, Dr. Casey Peavler. Can you tell us a little bit about yourself and about your background to start with?
Sure. I am originally from Kansas, which is the middle part of the United States, and I I did the majority of my training in and around Northeast Kansas. I went to the University of Kansas for undergraduate school, and I studied biochemistry, and then I ended up going to the University of Kansas School of Medicine for my conventional medical school. And it's interesting. I was prior military, and I thought that at the time that I wanted to actually be I kind of went through phases, but I wanted to be a neurosurgeon, and then I wanted to be a trauma surgeon. And it was based off the fact that I had been in the military. I'd been deployed to Iraq, and I really enjoyed, obviously I'd not enjoyed seeing people hurt, but I enjoyed being part of that kind of care. Mm-hmm. And so that's kind of my, at least some of the mission that I came with to coming into medicine was to do trauma. And I realized quickly that the civilian trauma is quite a bit different than military trauma. And I also realized that I didn't really like surgery, if I'm going to be honest with you. I like critical care. I like taking care of sick patients, and I still like that today, even in my current job, but I didn't want to be a trauma surgeon. And that is where it left me a little bit kind of lost, because I had went to, school, at least for several years, thinking that that's what I wanted to do. And so I ended up, luckily enough for me, getting really blessed with, my next rotation in my third year of medical school was internal medicine. And I had a great experience. I had excellent attending physicians, which, are guiding you through the process. I had excellent interactions with the internal medicine residents, and it just seemed like a good fit for me in terms of like what to do with the next step in my life. It's just that I knew from even in undergrad, I knew that I did not want to partake in the kind of the regular quote unquote conventional paradigm, when it comes to treating illnesses. I was already understanding, to some degree about preventive medicine, alternative, holistic type medicine. And I came into this kind of new revelation of, wanting to do internal medicine as the next phase of my training with that in mind. And I was really lucky, because one of my attendings, was interested in functional medicine, and she was kind of, exposing me to that to some degree. And by the time that I was, finally out of residency, which I ended up moving down to Florida to do my residency down in South Florida, I was ready to hit the ground running, and get some additional skills and training after my conventional training was over with. And that's kind of how I, got down this road. And then, I just never stopped learning. I never wanted to stop. I still, to this day, I want to learn something new every day. And I have a passion for a lot of different things. I think that where my interest kind of went to was the mitochondria. And that's kind of an interesting journey how I ended up there. But that's kind of where I'm at right now, is where I see the biggest bang for the buck. And, trying to apply that to clinical medicine, that's biochemistry, that's cell biology, and trying to apply that and translate that to the bedside has been interesting, but also difficult because, the system is what it is, and you're trying to take what makes sense from the research and trying to implement it, safely with patients, knowing the underlying mechanisms of certain things. And that's probably been the biggest challenge, but also, what maybe makes me quite a bit unique from other practitioners. So I hope that's a decent background of how I ended up where I'm at now.
Yeah, I mean, well, you said the standard of care and practice in hospitals. It's kind of, and there's a lot of repercussions for doctors too, that if they do go against that as well. So it can be a little bit a bit of a minefield to sort of navigate.
True.
So I understand that. Yeah. Now you have been speaking about cancer as a metabolic disease. So how did you come to, or how did you come to that?
Well, I think through a variety of pathways, not to speak in biochemical terms, but I was going through functional medicine training after I was done with residency, and I had read several books. One of the more impactful books that I read early after residency was a book by Dr. Gundry. It was The Plant Paradox, and then shortly after that book, I read a book by Dr. McCullough, who I had known about for quite a while, about a book called Keto Fast. And I believe around the time when I was, doing a lot of research into fasting and ketogenic diets is when, of course, somewhere on my YouTube popped up a lecture from Thomas Seyfried. And I want to say this is like probably 2017 to 2018 timeframe. And I watched the lecture and I thought it was fascinating, but that really wasn't my area of interest or focus, to be honest with you. I was really more interested in, at the time, I was really interested in the diseases that people were the most marginalized with. And what I mean by that is that, things that conventional medicine wants nothing to do with, like these diagnoses that kind of give conventional medical people chills, like chronic fatigue syndrome, fibromyalgia, IBS. These are diagnoses that sadly, no one really gets treated well with. The conventional paradigm doesn't have a whole lot of answers. It's kind of like, look, if your TSH is fine, you're either depressed or you're getting older, and deal with it. You know what I mean? Or, there's nothing I can really give you for this. So, you're just kind of a nuisance to our practice. And I hated that. And on top of that, I also felt, at least to some degree, I'd probably developed to some degree during medical school, but also during residency, my own kind of version of a chronic fatigue. So I had kind of a personal interest in it as well, trying to figure out the why. And I mean, I explored everything. I looked at Ayurvedic medicine. I was looking at Chinese medicine. I was looking at Taoism. I was looking at, conventional. I was looking at kind of more integrative and functional. And, what really ended up, making the most sense to me was mitochondria. And, I stumbled across, Dr. Jack Kruse. I'm not sure if you know who that is. Like, he's pretty well known. And I started going down his rabbit hole, I was just consuming every podcast that I could find. I ended up joining his website and becoming, a platinum member, and I'm still a platinum member, and I get, monthly webinars, multiple hour webinars a month. And I was trying my best to connect the dots that I understood. And right around maybe 2022, I was how do I say this? I feel like I hit the edge of what I understood with what I had learned so far. And I was really getting frustrated with a lot of the things that Dr. Kruse was talking about. Not that I didn't believe they were true, but because I just didn't have the scientific background. And a lot of times, one of the things that's a little bit frustrating about Dr. Kruse is that he doesn't really give a lot of site sources. He's able to connect dots from various realms of science, whether it be physics. I mean, not even just physics. It's like quantum mechanics, like AMO physics, like classical physics, and light and optics and nonlinear optics. And he's able to connect that with the biochemistry and things that I was obviously feel more comfortable with, because that's where my background is. And so I kind of went on my own little mission to not necessarily prove Dr. Cruz wrong, but like try to find what the heck he was talking about in the literature. And I started putting together this like PowerPoint for myself that I wanted to share somehow with people, whether it be patients that I see in my practice or somehow. And I ended up building this monstrosity of like 1,800 PowerPoints, and every slide had like a paper or two, about whatever topic that I was, trying to focus in on, when it comes to mitochondrial function and redox and so on and so forth. And, right around last year, about this time, maybe a little bit, maybe a month, like a month ago, like August 2023, my paternal grandfather had some abdominal pain. He ended up going to the emergency room and getting a CT of his abdomen and pelvis, and found this 12 centimeter giant, likely primary liver cancer, which is also known as hepatocellular carcinoma. And, at the time there was no metastases that were obvious, on the initial scans. He ended up going the conventional route and getting into, what most people do, and finding hemonc and getting onto chemotherapeutics, and the surgery wasn't an option because it was such a large tumor, but they ended up doing kind of like intrahepatic chemotherapies, and they did they didn't do any radiation therapy, but they just did like intrahepatic chemotherapy. And I knew some about cancer, obviously because I'm a doctor, but at the same time, like I didn't have any real expertise that I could give him and confidently give him any advice. And then I don't know what it was, but it's just, I had like kind of an awakening, where like I'm a hospitalist by trade. And so like I work in hospitals all over the country, and now I've settled down and I work in South Florida, but I used to travel every week, to a different hospital, different state, different town. And I was just seeing just an explosion of cancers. And it wasn't just like the people you would expect to have cancer, like people who are in their 70s and 80s and 90s. These were like 20-year-olds and 30-year-olds, and early 40s, and just having these like metastatic cancers. And it would be like, 20-year-old, 29-year-old female presents to the emergency room with abdominal pain. You think something like very basic, like, I don't know, like gastroenteritis or like some kind of bad constipation or, something. And they ended up, getting a CT of their belly, and they have like metastases everywhere, And it's like, holy crap, like what is going on? And so I just somehow found myself getting back into Siegfried's work, again, and started to connect a lot of dots between what I had learned over the last several years with mitochondrial medicine and connecting the dots with cancer biology. And since kind of one of my favorite things is biochemistry and, metabolism in general, and energy production, bioenergetics, et cetera, it really dovetailed nicely into this kind of field. And I could see that there was a huge vacuum of people who were not aware of this science, and then, God forbid, like knowing how to apply the science clinically. Again, another translational event, translating this bench research stuff that is out there in the ether of the scientific literature, but doesn't seem like anybody's reading, and if they are, they're not really applying it in clinical practice. So I wanted to explore that.
Yeah, I agree. It's it's really eye-opening to see just how many young, healthy-looking people nowadays have cancer. But like the information is out there. It's just so difficult to actually find it. Really, I know when I was going through treatments, I certainly didn't find anything on it as either. It was very much more just the standard of care, and we can talk about that as well. But standard of care in hospitals for cancer it's needs a lot to be desired, I would say, anyway. So how do you? Sorry.
You had a lymphoma, is that right, David?
Yeah, follicular lymphoma.
Lymphoma.
Yeah, with stage 4 and a large tumor. My tumor was 24 by 18 by 12 centimeters.
My God.
So it's quite large. It was wrapped
That's
around my
terrible.
aorta. So,
And
yeah.
you were able to, I mean, obviously you look well right now. I mean,
Yeah, I'm good.
what all did you do? I mean, what was your therapy program that you were, utilizing?
Well, the first 3 years, well, I was 2012 January. I was diagnosed originally very high stage 4. I went through R-CHOP chemotherapy, and then I did radiation on the tumor itself, and then I did 14 months of rituximab, and then I was stage 4 again. So it was almost to the day. 2 years later, so I then went into a bendamustine clinical trial, and then I did, which didn't do anything. So we went into a autonomous stem cell transplant. So that pretty much just left me broken after that. Almost didn't make it through that, actually. I stopped breathing a number of times, and but from there it was like I've been in remission. Actually, next month will be 10 years remission out of the hospital. And that just a few lifestyle changes, mostly dietary, but a high fat diet, no processed foods. And I found that, so much research just on, reading some of the great works like Wilhelm Stephenson and Thomas Seyfried and others like that. Another actually good resource I found is Dr. Sarah Pugh. She's really good. But yeah, get sunlight, eat a high-fat diet, and that's kept me in remission. So I'm feeling pretty good about that.
Did you make those changes prior to being in remission, or was it after remission that you made those changes?
I made those changes as after my transplant. Well, I was actually starting to change things while I was going through treatment. Going through treatment, I did a lot of fasting, but it was always after treatment because I just couldn't eat.
Yeah.
And I didn't really take up fasting again until this last year. But in between, it's just been a progression to onto a high fat diet, increasing my fat intake, because before it was always about lean meats and lean, green, and marine sort of thing.
Right.
And after the transplant, there was, although I did eat a fair bit of carbs as well, it was always home cooked meals, and even through treatment, it was always home cooked meals. But I found that a lot of the pills and medications that I was on was actually driving my blood glucose up a lot as well. So there was that problem too, which I think contributed to the second diagnosis as well. So
if I'm mistaken, R-CHOP, the P stands for prednisone, correct?
Yeah, that's right.
Yeah. So that's obviously going to raise your blood sugar, just that.
Yeah. Plus, a lot of the medications I was on, like afterwards for dealing with it, were steroid based as well. So that all drives it up. So
yep, sure does.
That was So it's standard of care. You're sort of damned if you do and damned if you don't. So that's the advice anyway.
Yeah.
It's tough. It was. I think this is when I was there. Actually, while I was getting treated, it was. I mean, beforehand, I was very fit, very lean, so I didn't look sick at all. Even when I was diagnosed stage 4, I was still hitting the gym. I was still fit.
How old were you when you were diagnosed?
I was 30. I was just on 38.
Wow.
Yeah.
So young.
But when I was there, the amount of children that were going through this stuff as well was absolutely horrendous. It was. I mean, the cancer is the #1 killer of children in Australia. over everything else combined.
Wow.
Like cancer kills more than anything else. And I noticed like in America, it's like 1,700 people a day are dying from cancer. And I think that a lot of that, it comes down to the standard of care as well. The treatments destroy your immune system and allow other infections to come in. So a lot of people actually die from, you know, what they call complications due to chemotherapy.
Correct.
So
it can be horrendous. I mean, if you don't die, it could be horrendous. Just the side effects, are horrendous. I mean, just something as simple as, like kind of this intractable nausea, vomiting, and diarrhea that people get, with chemotherapy, where they can't, they come in, they're so dry, they're so miserable appearing, and a lot of times, renal failure, just from that, like a tertiary effect, from being so dehydrated, from not being able to take in anything by mouth, yeah, man. I mean,
very much,
tough, man. Yeah,
it's not something. I mean, there's a lot of. I mean, there's so many side effects to chemotherapy that people don't understand as well. There's, like you're saying, like renal failure from dehydration, things like that. Their organs just shut down. Actually, their organs get a lot of damage. Actually, I'm feeling like I'm doing really well now, but it's taken the last 10 years to sort of recover from the chemotherapy.
Wow.
And even my liver now still, still needs work. But unfortunately, and especially after the transplant, I was so dry I couldn't move. Like I was stuck in bed for years after that. So how do with everything that you've been researching or studying in the background, it's cancer as a metabolic disease, how do you actually implicate, or how does this help you in treatment of cancer patients?
Well, I'm just to be very upfront, I'm an internal medicine doctor. I'm a hospitalist physician. That's my full-time job. And, I take care of, I'm basically the primary care doctor within the hospital, right? We are the kind of the quarterback of the team, I guess you'd say. And if there's any specialized treatments that we need, then we consult specialists, So for example, if someone was to come in with a gastrointestinal bleed, you don't want me doing an upper endoscopy on you, so I'm going to consult the gastroenterologist or GI and have them come do an upper endoscopy or an EGD or a colonoscopy or whatnot, but ultimately, like, that's my case. I'm the attending physician. And so in the hospital, I don't really have a lot of ability to do a lot for people, unfortunately. I can kind of investigate, kind of looking for kind of like root causes within what we have in the hospital. I don't have all the cool tools, I guess you'd call them, for laboratory studies. And, nowadays, I'm not sure how it's in Australia, but in the United States, at least, people are trying to get people in and out of the hospital as fast as possible, So even if I order stat studies, stat labs, which I do, if they're not back by the time the person gets out of the hospital, like, what good are they, And my role, frankly, is to be an admissionist, and I do the admissions for people. So I try to do at least a very thorough investigation on hospital day 0 or 1. And then my colleagues, will take over the next day, so I can follow up with them in some ways, like virtually, with looking at labs that I ordered or tests that I ordered. But in the hospital, I guess, needless to say, I don't have a lot of utilization of these things. I do find myself ordering vitamin D on pretty much everybody who has cancer these days, just because I'm curious. Not only that, but I also order, inflammatory markers, hyperglycemia and or, insulin resistance type markers, whether it be a fasting insulin, whether it be, fasting blood glucose or an A1C or hemoglobin A1C. I'm looking for drivers of the disease, and it's interesting because, over the last 6 months, I've seen a very clear trend, of people who have prediabetes or insulin resistance, frank diabetes, vitamin D deficiency, obesity, as well as this like kind of chronic inflammatory state that people have. And that's kind of like, I could explain for the most part, like cancer metabolism and transformation just off of those simple labs, Like, are there more to the story? Yeah, but like those are some big players, And I've been asking more people, in particular with cancer recently, where you're from originally, where have you spent the majority of your life, trying to figure out their mitochondrial haplotype, without looking at the actual DNA tests, but like, okay, yeah, you're originally from Central America or South America. You've been spending the majority of your time in your life up in, Minnesota, which is a high latitude state. You don't hardly get outside at all. You know what I mean? Like, you have darker skin, which means you're gonna need more sun than everybody else, and you're pale compared to what you probably would be if you got outside. And so I think that what I would say is I utilize it in terms of like asking the questions for patients and trying to connect some dots to them, and try to, in what limited time I have with them, explain, it's tough, in a 15 or 20-minute visit, when you're trying to ask all the other questions, why they're really there, nausea, vomiting, or, pain or whatnot for cancer-related, condition. But try to explain them, at least in a nutshell, what Warburg metabolism is, what cancer metabolism is, why a PET scan works, why that you should probably avoid, eating a bunch of processed sugar. And I always try to at least point them in the right direction, give them a Dr. Seyfried lecture. I don't necessarily tout myself. I think it seemed a little get corny if I was to like, hey, go to my YouTube channel and check out my series on cancer's metabolic disease. But if they at least they can see Seyfried's work or Jack Kruse's work or whatnot, at least point them in the right direction and let them know there's other ways. That's about the extent of what I can do in the hospital. When it comes to my practice outside the hospital, that's where things have changed quite a bit, because I had opened up an integrative medicine practice or functional medicine practice in 2020, about the worst possible time in the world. It was like January or February of 2020, right before the freaking pandemic started. And it was interesting. It was interesting mostly, mitochondria, fatigue, these things that that I knew people were getting marginalized with. And so when I started my channel back up again, and kind of like late April 2024, with this interest about cancerous metabolic disease, the goal, frankly, was just to get as much information out as I could, to people. Like, if I could just help one person, like, understand that, like, they shouldn't be eating, sugar-laden foods, and get outside and get some vitamin D and melatonin, then I feel like my work has been done. Or if I can at least like show people some adjunctive, integrative therapies that they can add into their standard of care, like that, I feel like my work has been done. But unexpectedly, I've just been getting a bunch of requests for consultations from all over the world, man. Canada, England, all over the United States. And it's really a little bit overwhelming, because it wasn't my intention. I want to try to help people the best way I can. The law really limits me in a lot of ways, because I have a medical license in the state of Florida. I can't really treat you outside the state of Florida, and it ain't cheap, to fly from California to Florida, to meet me, and lastly, just being very frank, I don't have a center where all these therapies are under one roof. Now, I hope to have that someday, but I don't have it right now. So things are really in flux for me right now. I'm trying to figure out how I can best serve my fellow human here, and at least steer them in the right direction.
Yeah, I know. It must be frustrating. Like I said, there's so many people affected by cancer around the world, and there's really not a lot you can do for them. Except just, like you said, try and get the information out there that they can, at least take charge of their own treatment themselves. But yeah, it's very difficult for people to travel like that too. That was actually one of my next questions. Was how many patients are you seeing with a low vitamin D and chronically elevated blood glucose levels?
Yeah, man, that's a great question. Most, to be God's honest truth, most, and it's sad, because I think that I'm, in a lot of these cases, the first doctor to actually check these things, and start to connect some of the dots. I just recently had an ICU downgrade from a lady who, young girl, like early 30s, had came into the ED with abdominal pain, ended up having like a colonic obstruction, had to be, kind of like emergently operated on, because I think they had an abdominal perf, and went to the ICU post-operatively and downgraded to my service. And, I diagnosed her pre-diabetes, just the fact that she was young and had cancer. You know what I mean? I just was like, okay, let me check an A1C, and boom, you know, I think it was like 6.1%, which is right in the middle. I mean, smack dab in the middle of the pre-diabetes situation. If I'm not mistaken, you know, she had either a very low double digit or single digit vitamin D level, you know what I mean? Which already shows me that she is got so many processes working against her, you know, possible. And then just knowing what humans do these days, we're on our phones, we're on our computers, we're watching TV at night. We don't have darkness ever. You know, her melatonin levels likely are bottomed out. You know what I mean? So she's got multiple systems working against her in the background. And you would probably look at this person, you know, 10 days prior for presenting to the emergency room and to the hospital. You probably think that girl's fine. You know, she's not fit. Maybe she's not where she wants to be, but like, she's not a cancer patient, metastatic cancer patient. She's a metastatic cancer patient, and the drivers are there. The clues are there. And that's what I've been trying to lay out in my lectures, you know, show the different drivers of the Warburg effect, the hypoxia and pseudo-hypoxic kind of mechanisms of how it happens, because it just seems so hard to believe until you start digging into the things that drive those things. You're like, okay, well, those are actually pretty freaking common things. I probably have one of those, you know what I mean? It's like, oh man, I better get my stuff together, you know what I mean? So yeah.
Yeah, that's one of the things that when you go into especially a public hospital, they never ask you about lifestyle. They never ask you about your diet. They just, okay, it's a genetic thing. There's nothing you can do about it. This is the advice that you get, and it really sets you back onto the patient as it's like, well, if there's nothing I can do about it, it's just my genetics. I'm just unlucky. They just give up, you know, and they figure that it
completely disempowers the patient, takes all responsibility away from them, makes them a victim completely, makes them a complete bystander in their healthcare. They are just to do what they're told, or they're going to die, and that could not be further from the truth. They're, unfortunately, without being, you know, shaming or anything like that, but they have direct responsibility for how they got sick. Now, they may not be aware of the things that got them sick. You know, their environment is likely the problem. You know, one of my favorite sayings from Dr. Cruz is, you cannot get well in the same environment in which you got sick. You know, that's epigenetics is what he's referring to there, right? And it includes everything, the things you know about, like most people know about food, people being sedentary, smoking. Most people know about that these days, you know what I mean? Yeah. But when you talk about the things that you don't know about, you know, that's where it gets a little scary, because, you know, you're essentially completely oblivious to the drivers that are around you. You know, that's where it gets a little scary.
Yeah. Well, that's right. I mean, it like you said, disempowers them. It takes all control away from them. And you basically, when they prescribe chemotherapies or whatever treatment, radiation, and that, you're just along for the ride, you know, and you really just you don't have much say in your own treatment. And
if you do, I mean, I've heard horror stories. I don't know about you. I don't know if you've heard horror stories. I've heard horror stories. You know what I mean? We're talking like the doctor doesn't look at me when they're talking. They're on their computer. They're just ignoring what the person's saying. But I think what really bothers me the most is people come in with the desire to live, with the desire to make some difference, with the desire to, let me participate in my own healing. And they just get, you know, they bring in, you know, reams of, you know, studies and documentation and like, can I try this? And they tell them, no, you can't try that. 2, it's not going to do anything at all when they don't even know that's the case. And 3, they just throw it into the garbage. I mean, how disrespectful to another human being to take, even if it was useless, man, to just be like, that's garbage. You know what I mean? Your efforts are garbage. I mean, that's horrible, you know?
Yeah, that can be the problem for a lot of people. Some doctors just don't want to be questioned on their education, you know, and what they think they know. So, I mean, I was pretty lucky, actually. My oncologist is very good. And, you know, I mean, he just didn't have the answers. Like when I questioned him about certain things, certain types of treatment, he just didn't know how it would affect, like, such as diet and things like that. So, so I just started looking elsewhere for the answers. So,
Well, at least, I mean, like, it's okay not to know. I mean, David, I'm sure you don't know everything about your profession. I don't know everything about my profession. Like, I'm not God. You know what I mean? Like, but it's when they have that all-knowing attitude when they really don't. That's the problem. You know what I mean? That's the big problem.
That's right. That's a big problem, and it's a shame because it's, you're dealing with people's lives. So it's but it is what it is. For some people it's an ego thing, some people it's something else. But anyway, so as now I've seen you talk about this before. Now, talking about cancer as a metabolic disease, Professor Seyfried says that the two fermentable fuels, or the only two fuels that cancer can feed on, are glucose and glutamine. Fat not being a fermentable fuel, being the only source of fuel that we should be running on. Now, some people have obviously blood glucose is carbohydrates. Everyone knows, well, they should know that any carbohydrate form is glucose in the blood. What about glutamine? Is there a way how does D3 interact with glutamine when we're talking about dietary and uptake?
Sure. So just to, I guess, tease apart some of the question, we can live on ketones, like obviously there has to be some degree of blood glucose or else you die, you can have hypoglycemia and die, seize and die. And I've seen it, but it's much more difficult. If you are able to get yourself in a therapeutic ketosis, you can not only survive, you can thrive, and you have just enough blood glucose to make the system work. Your body will make its own blood glucose through gluconeogenesis in the liver, right? But glutamine is a much different beast, because glutamine is, although it's considered non-essential in terms of, you don't have to take it in from the diet, essentially. Your body can make its own glutamine. It is an essential amino acid in terms of like function for the body. So you can't, unlike just putting someone on a ketogenic diet and having them fast, and even doing like glycolysis inhibitors or things that lower blood glucose, strategies for the glucose side of things, that part of the fermentable fuel source, which is the major one, that Warburg effect, its majority is glucose. But the glutamine's a much different situation and that's why Dr. Seyfried has created this press pulse idea, because you cannot just press down glutamine indefinitely. That will cause significant morbidity and probably, maybe mortality, right? Like you may die of it because you need it. It's important for your gut, it's important for your immune system, but it's actually the most abundant amino acid in your bloodstream. So it's not something you can just like shut off for long periods of time. So that is what makes it a lot more of a nuance in terms of the strategies, So what Dr. Seyfried has talked about many times through the majority of his videos is kind of singled around one molecule. And everybody asks me about this. It's about DON, 6-deoxy norleucine. I don't know it off the top of my head because it's quite a long word, but it's essentially, it's a leucine analog, which looks like glutamine, and it blocks some of the glutamine enzymes that are responsible for utilizing glutamine in the TCA cycle, so it cannot be fermented and utilized by cancer cells, right? And it's cool because the drug was actually studied in like the 50s all the way up to like the 70s and 80s, and there's actually quite a few clinical trials on the medication. There was a great publication that came out in 2018 that's kind of summarized those things. But the issue is it wasn't ever used in combination with a ketogenic diet. It was used standalone or with an old medication called cyclopentapurine. And so it was only used in those settings. They used either an IV form or they used a by mouth form. And so there's a lot of data about like kind of like how effective it is like by itself. And it was pretty effective, depending on the dosing regimen and how people did. But there was quite a few side effects. Because of the glutamine issue, because glutamine's necessary, there's quite a few side effects in terms of the gastrointestinal system. A lot of nausea, vomiting, diarrhea, some like even what we call hematochezia or blood in the stool, because basically the enterocytes or the colonocytes that utilize glutamine heavily are being shut down, and they need that to survive. So, because those are rapidly dividing cells. So let's tie that into vitamin D. So unfortunately, one of the things that I wouldn't say bothers me, but just is something that is, for me, like the elephant in the room with Dr. Seyfried's work, is that he focuses on ketogenic diets, fasting, exercise, stress reduction, all fantastic modalities, right? But there are a lot of other things that are found within the literature that can help lower glucose and glutamine both, and that are from natural sources as well. And so vitamin D, if you have had a chance to watch my, series, my micro series on vitamin D, one of the videos is about vitamin D's actions upon the glutamine system within the cell. And it has pleiotropic effects on multiple areas of the cell, but it has even several effects within the glutamine system, not only with uptake of glutamine, but also of conversion from glutamine to glutamate. There's several different enzymes that it has direct effects upon, so that it cannot be fermented pathologically, like it's used in cancer under the Warburg kind of metabolism.
Right. Let me explain that. Do you supplement with D3, or do you try and get a natural source?
I chuckle because I'm not complaining, because I'm happy to have the conversations with people, in the comments of my videos. Mm-hmm. But the continual fight I have is this kind of indoctrination that we have to get these things from a pill. And what I tried to lay out, I did my best, and I'm sure that I can maybe say it a different way in another video, but I have tried to make the case very strongly that getting vitamin D from a pill is not the same. It just isn't the same. It never will be the same. And for me, it is the last resort. There are people in the hospital who are going to be laid up for a couple of weeks or whatever. I give them mega dose. The pharmacy's continually calling me because they're like, Dr. Peavler, are you sure you want, this much vitamin D for this patient per day? And I'm like, dude, you don't even question these other medications that are really toxic. But when I give someone some vitamin D, and they have single digit vitamin D, I'm getting questioned. Anyway, I'll digress. My point is, vitamin D is not just what we think it is. I've tried to lay out that there are there are dozens of these D3 and L3 metabolites that are made in the mitochondria, and they all have bioactive activities, anti-inflammatory, immune stimulating, they upregulate vitamin D receptors. So, if you have a receptor issue, it can kind of help, against that. Just anti-cancer, you name it. It's just unbelievable effects. And you're not going to get that by taking the pill in general. You're going to make 25-hydroxy, you're going to make 1,25-hydroxy, and 1,25-hydroxy, which is also known as calcitriol, is the active form of vitamin D, quote unquote. It's what we learn about, in conventional medical training as being the vitamin D that is active. But we know now that there's a lot more than that. There's these D3 and these L3 lumisterol derivatives that also have biologic effects, and that you're not going to get by taking the pill, at least to the same degree that you do in the sun, because they're made in the same mitochondria where the vitamin D is actually converted when the UV hits it. Number one. Number two, if you look at studies where almost all cancers are associated with vitamin D deficiency, including skin cancer, which make sense, right? Because that means you're not getting any UV. And when they give the vitamin D pills and they give them adequate doses of vitamin D, the distinction or the discrepancy that you would see if it was truly a vitamin D issue are not made up for, and I've made that pretty clear. And I think definitely Dr. Cruz has made it very clear too. So there has to be something more than just the vitamin D, right? There has to be something else. And that's where you look at all the other things that are made when exposed to solar light. I've talked about it in detail, but it goes all the way from about 250 nanometers, which is right before UVC. UVC ends at about 260, 270, I think, nanometers, and it goes all the way up to 3,000 nanometers, which is deep into the far infrared. And all of those spectrums likely have biologic activity. And so when you're getting sunlight, you're not just making vitamin D, you're making all the analogs, you're making alpha, beta, gamma, MSH. And I didn't realize this until just recently, but those just to go back to a little physiology, those stimulate melanin, production. You would think that those were precursor hormones that don't have any other biologic effect. They do. They're powerfully anti-inflammatory. And so you have these other things that you're making. You get the ultraviolet will make nitric oxide in the skin and lower your blood pressure. There's all these other effects that you're getting from being exposed outside, not to mention melatonin in like nearly unlimited quantities, which we know has powerful cancer effects. So you need to, that's what that's been one of the hardest things actually since starting this channel, is getting people. I mean, and trust me, I was indoctrinated too. I'm a functional medicine doctor, and in functional medicine, it's about give this pill for this, and it's very much like a green allopathy, which is kind of what turned me off to some degree about it, because it's like you're just giving pills. You're not, one of my favorite quotes I think about Hippocrates is true medicine is to like teaching people not to need it. And if I'm giving you a pill that you're going to take the rest of your life, how am I teaching you something you don't need? You know what I mean? Especially when you can get it outside for free. So it's like the cost issue is now gone. You know what I mean? And you're getting these other benefits that are not found in the pill. That's been my fight, is telling people, trying to make it to get it from the sun.
That's one of the reasons I think the sun is demonized. The sun gives you skin cancer because they can't sell you a pill otherwise.
Well, and not to only mention, if you actually look into the literature, that's actually not the case. There's a publication that I read called "Melanoma is not caused by sunlight." I mean, it's just like, could it be more clear? When you look into the meta-analyses of people who get consistent sunlight, they actually have like a 20% decreased risk of melanoma, which is the one that you're really worried about. Basal cell carcinoma, squamous cell carcinoma, I'm not saying they're not dangerous. It's just that they're so infrequent and they don't kill people like these other cancers that are like profoundly affected, like lung, breast, prostate, all the other cancers that are really causing the majority of these cancer deaths. The 1,700 you're talking about per day, not very many of those, probably less than 1% are melanoma, but a bunch of them are lung.
It's certainly not caused from the sun though either, like you said. I think it's all pretty much based on, the same reason we all eat too much processed foods, too many seed oils, and too much sugar. So, highly processed foods that are the problem. We never had a problem until 200 years ago. Before that, we survived quite well out in the sun. We survived quite well on eating meat, and it's only getting worse. The less meat we eat, the less time we spend in the sun, and the less active we get, and the more processed foods we eat.
And also the lack of darkness too. The lack of darkness, the artificial light, the way they say in the literature, that's also huge.
Blue light.
Yep.
Blue light is another one. That's why anything after dark always. Melatonin is such an important hormone. Actually, I think you were talking about that recently. This is what I mean. It's not just D3. It's about getting all your hormones into the correct function. That's what light's all about. Get your morning light through the day and darkness at night. And I think the peak production of melatonin at night is between 8 and 12. So those are the best sleeping hours to get. And it's equivalent to every hour before 12 o'clock is like sleeping 2 hours, because it's that good for you. And that's when your recovery happens. And when people are presented, I've seen people present with when they do have cancer or any kind of chronic disease, they usually, apart from being low in D3, high in blood glucose, they're also very sleep deprived. So there's a lot of things going on that cause these diseases.
Yep.
Diabetes, a number of people I speak to recently, they've pretty much labeled cancer as diabetes type 5, dementia and other things being type 3 and type 4. So, there's a whole myriad of things that just stem from elevated blood glucose. And like you said, things like sunlight lowers it. It's sunlight activity.
We're talking 30 to 50% probably. And that's just for a small amount of time. I mean, the study with, I think it was Glenn Jeffries, where they shined 670 nanometer light, which is deep into the red range, 15 minutes before, a meal, lowered your blood glucose by 30%. I mean, that's 15 minutes. Imagine and first of all, they always use one spectrum. Imagine if they use the entire solar spectrum. I suspect the effect is more profound. And, that's only 15 minutes. Imagine if you were there for 30 minutes or for an hour, who knows, right? Like what the effects are. And the other end of the coin is that light, especially light at night, will raise your blood glucose without eating through several mechanisms, not only mitochondrial dysfunction, but increasing your cortisol, which will like basically your endogenous steroids, right? And catecholamines such as norepinephrine, which will raise blood glucose independent of eating a meal. So yeah, I mean, the environment is pivotal.
Yeah. Yeah, actually, recently there's been a few people call that out, actually blue light being the cause of elevated blood glucose and diabetes, leading to diabetes, or because of blue light at night. Just these new bulbs and computer screens and things like that. It doesn't matter whether you eat or not.
And what's scary is that, well, scary and cool both, is that, melanopsin, when they discovered it, they thought it was only in the retina. So, you wear blue blockers, you're good to go, right? Well, no, not so fast. It's in your blood vessels, it's in your skin, it's everywhere. So, it's really difficult, to have any kind of a modern quote unquote life. And, I'm not immune to it either. I mean, I work a swing shift, 3P to 3A. And so, at least half of my shift, the sun is down, and I'm under fluorescent lighting. And I wear my blue blockers in the hallways and in front of the computer. And I try to get into a room, like a cubby hole, like a doc box, where I can turn the lights off, and the nurses probably think I'm nuts, but I try my best to avoid it. But at the end of the day, like, it's unavoidable, in modern life these days. It takes a lot.
Yeah, it's skin exposure. I mean, blue light blockers are great. I use them myself. They certainly help me to sleep. But it's also skin exposure. You're absorbing that through the skin as well. So it makes a big difference. Unfortunately, I mean, you can get, I suppose, if you put like red light bulbs all through your house or something like that. Maybe
I have.
Yeah.
As a matter of fact, I don't know if you can tell, at least on my end, like my camera, it looks like I have a red tinge. That's actually a balanced blue and red. But this is a pretty cool system because I can adjust the color temperature all the way down to red if I wanted to with this light. Yeah, it's a pretty neat light. It goes to like really, this is kind of like daylight, It's like a pretty high color temperature, but you can adjust the color temperature. I've got it kind of in an evening because it's evening here. It looks a lot more red than it is to my vision, here in the actual room. But yeah, it's a pretty cool light. It's by Chroma Lights. It's called the Sky Portal. It's a sweet thing. They sent it to me. They actually sent it to me for free. I was really grateful.
Yeah, so there are lifestyle things that we can do to optimize. We can't really avoid it altogether. So let's go through some of the life hacks then. What are some of your life hacks to optimize your mitochondrial health then?
Man, that's a loaded question, David. Especially for someone like me who likes to talk about mitochondria. I utilize fasting on almost a daily basis. I do intermittent fasting. It's not ultra regimented. Like, I don't stop at a certain time and I start at a certain time. But, I do, especially on days that I work at night, I do stop eating. I try to stop eating around sunset. So my last meal of the day generally is 7, 8 o'clock at night. And I will, finish my shift and then go to bed, and then I'll wake up, and I'll probably have my first meal around, again, this is my work week, where I have my first meal around noon to 1, so there's a decent amount of fasting there that I do. I do mind my lighting as much as I possibly can. When I'm home, obviously it's much easier. I can turn things off, or I can have the red, bulbs in the house, and I find that makes a huge difference. I have a variety of red, blue blocking glasses. I mean, these are from EMR Tech. These are the ones that I wear in front of patients. These are like a clear lens. It blocks about 30% of blue. And then I have an orange tinge that I have from Raw Optics that used to be my night lens, but I didn't find that it was quite powerful enough. And I bought the ones from EMR Tech that are red, truly red, and they're prescription because I have myopia. So they're prescription, and they're really cool. I find that makes a huge difference in my sleep and just like how I feel too. Like I tend to get headaches if I'm exposed to blue light at night, and especially if I'm working on the computer, EMR, and my job is heavily computer oriented. I try to set up a sleep cave where I have as little EMF as I possibly can. I'm still working on that because that's kind of like building biology type stuff and like looking at shielding materials. And so I'm still in the process of that. I sleep on a Magnetico sleep pad, 10 Gauss. I have an infrared sauna that I custom made that is a clear light full spectrum infrared sauna that I added some cool stuff to make it more powerful. And I actually have to use in my house, I have to use 2 separate breakers because it's so many watts. It will trip a breaker, you know what I mean, on a normal 15 amp or 20 amp circuit. I use that. I'm trying to get into cold water immersion. I want to get a cold plunge. I don't have one right now. I've done some cold baths, and I've been in like cold rivers and cold oceans and stuff like that. I would like to do that more. I definitely try to maximize my outdoor exposure. Getting that morning light you're talking about, getting the evening light, getting my afternoon 30 minutes to 60 minutes to make sure I'm getting adequate amounts of UV. When it's solar noon, and I get max vitamin D production, but also melatonin. I do exercise, not as frequent as I should. I do eat very clean. I think that's probably where my saving grace is a lot of times with my schedule. A lot of times I think my diet is pretty solid most of the time. And I try to get steps in. I try to, what else, man? I don't know. I have a couple different red light devices. I find that they're good. I'd like to get a big EMR tech, like their Fire, oh gosh darn it, it's not the Firehawk. No, I think it is the Firehawk, like the big one for my practice. But honest to God, man, and I love EMR tech, but I just find that there's nothing, no sauna, no light, nothing that can replace how I feel if I get a good amount of sun exposure in a day. I mean, mentally, I feel better. I feel more calm, relaxed, and I feel just overall just like a sense of well-being. So I think that's probably the most important thing that I do is I get a lot more sun exposure. I try to get grounded too. I mean, grounding is important. I do live in South Florida, and I have access to the beach. Right now, I live about 45 minutes away from the beach, so I don't get to go that often. But hopefully I'll be moving closer because my job is really close to the beach. And I would love to be able to go walk on the beach with my feet in the water, maximally grounded in salt water, and getting solar exposure at the same time. That's something that I want to implement in the near future.
Yeah, they're all great things too. I do that too. Like I said, red light therapy is great, and it can be very therapeutic, especially if someone is trapped inside. But it can't replace the sunlight, and it's free.
No matter what panel you get, no matter how awesome your custom sauna is, whatever it is, just nothing compares to God's light, man. There's just nothing.
Yeah, exactly. Nothing compares to sunlight. One tip I have for you though, if you instead of a cold plunge, if you do a 20-minute soak in a bathtub as hot as you can stand it, and then have a straight cold shower, it'll give you the same cold plunge effect. Mm-hmm. Plus you have heat therapy to go with it. Yeah,
sure. No, I find that is for me one of the harder things to implement. And I don't know what my mitochondrial haplotype is. I mean, I'm from the 39th latitude, so I have to imagine that's not such a equatorial haplotype where I can uncouple. But I just have never in my life been able to tolerate cold very well. You know what I mean? So I think that's probably the Mount Everest for me is really getting into cold plunging. But I have a lot of desire to get into it, or cold showers or just cold exposure in general, because I know there's a lot of benefits to it. I mean, a lot of mitochondrial benefits to it.
Yeah. Yeah, really. I mean, it's like a detox for your body. It feels good. It really stimulates your lymphatic system a lot. So, which is something I sort of, right into. So, how about books? What books would you suggest or recommend for people who are being recently diagnosed with cancer?
That's a good one, man. Because there's so much out there, and it's one of the things that I would say before you even start reading books is figure out what is your ethos. You know what I mean? Are you going to fight using only conventional medicine? Then maybe it's less important. But if you're interested in doing all alternative or all holistic or all kind of stuff, then I think you need to become a student, and you need to find someone who's like-minded, a practitioner, because they can help you organize things. They can help teach you things that you may not know, because your background may not be in science, you know what I mean? And a lot of these books, to some degree assume a level of science, and understanding about the scientific world. And I think it can be extremely confusing And of course, everybody's got their 2 cents. And so, is this diet good, or this diet good, or is this fasting good, or is this, and it can be very overwhelming and confusing for people. So I think it's important to have kind of a mentor or guide to help guide you. And, so that's probably issue number 1. And then number 2, Dr. Seyfried's book, Cancer is a Metabolic Disease, is, one of the more popular books. But, I like a lot of different books. I like Nasha Winter's books is good. I don't remember what it's called, but it's an excellent book. I read the Jane McClellan book, How to Starve Cancer and Kill It with Ferroptosis. That book's pretty good. I don't necessarily agree with all these things these authors are saying, but it gives you a good background understanding about like what the goals of these various metabolic therapies are, and gives you some background. I do think that, some of Dr. Mercola's books, like the Keto Fast book, is pretty good. I know that I really like listening to Dr. Jason Fung. He's a nephrologist. His Starving Cancer or something like that is a good book. There's so many good resources, but yeah, it can be a little overwhelming, and that's where someone who can guide you can be helpful. I'm kind of a scientist at heart, so I would say like the literature, but that's dense material, and hard to, kind of decipher sometimes. But that's where the books get their magic from, is the literature. Most of them get the good ones, at least.
Yeah, I agree. Yeah, there are some really good books out there written by some great people. You might not agree with everything that they say, but there's always a good amount of information in there that you can still use. But yeah, it can be a little dense, and it can be a little technical for a lot of people. I like to break it up too. There are really good books that are very easy to read that will help get you along the way as well. So what does your diet look like then?
Yeah, so I think being based, and influenced heavily by Dr. Cruz, I try to eat a seasonally appropriate diet. I can't always eat locally, but I can at least eat for the most part seasonally. So what I find myself doing is I eat slightly more carbohydrates in the summer. And although we have kind of summer and summer light here in Florida, but I try to eat a little bit more carbohydrates in the summer, and I eat probably a little bit more, like, I don't know if I'll ever go ketogenic, because I don't have any real major diseases, but definitely I like a higher fat, diet in the winter, and more, I'll do more kind of berries and other things in the summer. I think that whole foods is very important. To reiterate that, being, real food is important. I have, again, based off the influence of Dr. Cruz, I eat a lot more omega-3 rich foods these days, seafood. And I can tell you that from someone who's did a lot over the years, a lot of omega-3 supplements, that I can tell a huge difference. And I'm talking like gram quantities of DHA a day, like 3-4 grams of DHA a day from supplements. What I consider the best supplements that I could find, and I kept them in the refrigerator and make sure they weren't oxidized to the best of, my ability. I can tell a huge difference if I eat, shrimp or crab or lobster or salmon or other fish that are high in omega-3s. I can tell a huge difference. And it's probably not just the omega-3s, it's probably the other minerals and other, nutrients that are in those fish. And it's probably that the omega-3 is to some degree more protected because it's not been on a shelf, in an Amazon warehouse or whatever, for a period of time. So I know that was a long-winded answer to say that I eat a lot of whole foods. I try to have a condensed eating window, and I try to eat when the light's out, even when I'm working that swing shift. I try to eat seasonally, and I do organic as much as I possibly can. But I also know at this point that even though diet is important, there's a lot of other factors. This is where I don't want to get pigeonholed into like prescribing one diet, because I don't think it's all one size fits all. And I don't know if I believe to the degree Dr. Cruz doesn't believe diet's important, but I believe that there's a lot of other factors. One of the, just kind of tying in, when I was in functional medicine training, it was like about, finding the root cause for this disease process. And I think that as I've got a little bit more mature, is that I realized that there's a lot of different influences, a lot of different root causes that lead to a problem, right? And so the same with cancer. Like it can't just be about mold and fungus. Like there are people who will like pigeonhole themselves into it has to be just about this, or it has to be just about this. And it's like, no, we need to like look at the whole, whatever we can find to fight in your defense, the better,
Yeah. And I think like even no matter what you eat as well, it's really about avoiding heavily processed foods. And that what a lot of people don't understand as well is that includes the supplements. Like getting it from the food source is imperative for your hormone production. That's why I keep trying to tell people these hormones, especially like D3, is a hormone that your body should be producing by itself. You don't need to supplement. And you probably shouldn't, because you need your body to produce it itself. So even when you try and add these supplements in because your diet, not getting it from your diet, these are heavily processed, not foods, but these supplements are heavily processed, and the oxidation, a lot of them actually only have trace elements as well. So you're really not going to absorb anything from them. So the whole thing is
fillers, there's other issues, there's cost. Yeah. I mean, there's a bunch of problems. Dr. Cruz in particular talks about deuterium content of supplements. It's a little bit above my pay grade to really talk about that at a high level, because I don't have a spectrometer or whatever you need, to detect deuterium levels in supplements. And I don't know how big of a problem it really is. But yeah, I mean, there's contaminants. There's issues along with that. And then it's not just about, I think one of the other things that we are starting to understand more now, but it's not just about the amount of the supplement, right? It's like also the timing. So are you giving melatonin at the right time, or the vitamin D at the right time of the day, right? Like there's a lot of work done by research on exercise, and in particular, giving antioxidants around the time of exercise can actually like completely mitigate the benefits, because it works upon oxidative stress and inflammation, and that's actually required for the adaptations to happen, right? So even taking things that may be good, you may completely be, like mitigating the beneficial effects, by taking something good at the wrong time, So that's why it's more than just even the substance. It's about timing and when it's released and how much, and there may be even more to it than that. Like is the curve the serum curve of melatonin, is it spiked a certain way? Is it a longer, kind of a bell curve? Is that relevant? I don't know, but I think that I'll bet you it is.
Yeah, that's a good point. The timing, because that's one good reason to have your body linked to the circadian rhythm, is because your body knows when these hormones are supposed to be produced. And when you start supplementing with, externally, then you're sort of throwing off not only your hormone balance, but the hormone production, but the timing of when these hormones are optimal for you to when you need your energy and when you need to sleep. So this whole thing makes a very big impact to your health. So I try to get people to understand that avoiding processed foods is also about avoiding processed supplements, and that's but that's it's kind of it's a difficult thing at the moment, but I think people are starting to catch on. So is that something you've noticed?
I think there's a time and place. I'm not completely anti-supplement, but at the same time, like I think there's a time and place, and with whatever we do in any form of medicine, there's always a risk versus benefit with any intervention. And you have to be able to try to assess that and convey that risk versus benefit to your patient, and have them understand the best way you can that like I think that there's a net positive here. There's not a net positive, then why are we doing it for?
Yeah, that's right. Yeah, that's right. I mean, I'm not totally anti-supplements, but you have to be careful about how your source for one, but also how and when you take it. But I used to be supplement king, but I think that's what led to my diagnosis as well. It's one of those factors that it's culminated to my diagnosis as well. Okay. Any last bit of advice you'd like to give people to who just want to live a healthy life?
Yeah, man. I think that we have more tools at our disposal in our environment that we don't realize and that we don't utilize. And one of the things that I hate, okay, and I mean it, hate about integrative and functional medicine, because it's not covered by insurance, is that it is costly, man. The labs, the consults, the supplements, the whatever, the diets that they prescribe, they're expensive. And I'm not saying they're not efficacious. I'm not saying it doesn't move the needle in the right direction, but I'm saying it really selects out for a very subsect of people, right? People who have means. And what we don't realize, and I'm starting to realize also, is that we have a lot of control of our health determinants and outcomes that don't cost a single thing. It doesn't cost anything to get outside and get your foot on the grass. It doesn't cost anything to see the sunrise or see the sunset. It doesn't cost anything to fast. It doesn't cost anything to find a cold body of water, whether it be ocean, whether it be a lake, whether it be a stream, and go and expose yourself to that. It doesn't cost anything to get yourself exposed maximally to light in the sun. And so my point is, I think that the most important thing you can do is something that you can do, that you are willing to do, but also you really leveraging and leaning into those things that don't cost you a thing. I think that's what I'm trying to lean into right now.
Yeah, no, I agree. Exactly right. Nail on the head there. It's just, there's a lot of things that we do have access to that cost absolutely nothing. And it will change your life. I think it really does change your life if you can go outside, do some grounding, do some deep breathing, for example, and get some sunlight. It really does make a very big difference to a healthy lifestyle and hormone production, and whether you are healthy now, you want to stay healthy as well in the long run. But if you are sick, even if you have a chronic disease already, this makes a very, very big difference to your survival chances, to your recovery chances. So
I think, David, one of the things that's frustrating about that message, because I share that message that you're saying, is that it seems too easy. It seems too simple. It has to be the next greatest thing. It has to be this new technological, expensive treatment, right? For me to believe that it'll work. And that's really one of our biggest hindrances.
Yeah, it is. Yeah, we've all been, unfortunately, we've all been indoctrinated to believe or to trust whatever a white coat says. And, if it comes in a pill form, then, that's going to be healthy for us.
Correct.
But it's the way it is, hopefully. But there are a lot of, I think there's a growing number of people now that are trying to find alternative ways, trying to find alternative methods rather than trying to get off medications, which is a really good thing to see. It wasn't something, I was the same. I was exactly the same before I was diagnosed. I was, like I said before, I was the supplement king. I had all a range of these different supplements that I took throughout the day. And, when it came to, my diagnosis, they said, take this pill. And I said, yeah, sure. I didn't, it was no problem. It was just a normal thing to take pills. But, a lot's changed.
Yeah. So well, thank God it did, because you look very well, my friend.
Yeah. Thank you. Yeah. I'm feeling great, actually. And like you said, the sunlight makes you feel so much better. It really
changes
does.
my entire outlook on life. I'm so much more positive. I go to work, maybe I don't want to go to work, but I just have a more positive outlook on everything. It just there's no area of life where I think it doesn't affect, I feel like I'm lighter. I feel like I'm leaner. I feel like I feel like I just function overall better when I get sunlight.